The trauma center at the Makindu Sub-County Hospital in Makueni County had been meticulously prepared to host the head of state. But it's only a thin veil over the true picture of the country's other hospitals and the entire public healthcare system that is in dire need of fresh medicine. Patients left to their fate as health workers tussle with the government over better pay. The president pleading with the striking health workers to give dialogue a chance and ease the pain of hundreds of patients who now cannot access healthcare.
Lakini jameni, tuwe watu ambao watakuwa na huruma na maisha ya wananchi. Tusiseme ya kwamba ati mimi lazima nipate ndio nifanye huduma fulani. Unajua hiyo ingekuwa kama tumekataa kuongea.
The president was optimistic that there would be a solution soon as the government was engaging the health workers. In the meantime, he asked them to go back to work.
Hata mkisikilizana yale maisha, jameni, mutafufua. Jameni, good faith requires people to understand that we do not put the lives of our fellow Kenyans at risk.
The doctors' union, however, doesn't share his optimistic views on an end to the strike in sight or a conducive environment for talks.
The government has been negotiating in bad faith. We came here for a meeting from the morning up to now. They're not telling us anything. They are taking us in circles. Already, the government has moved to court, and we have information that they want to arrest the union officials.
The Labour Relations Court has summoned the Doctors and Nurses Union officials Tuesday to show cause why they should not be committed to a civil jail for disobeying earlier orders suspending the industrial action. Judge Helen Wasilwa ordered them to be arrested if they ignored this summons. The Council of Governors, which is also negotiating with the striking workers, had obtained temporary orders suspending the strike to give room for dialogue. According to the court, the mass demonstration was illegal.
We have declared that we shall not negotiate until the government withdraws and court issues if they want to negotiate in good faith. Thank you. And as we speak, no more talks. The strike continues.
Even as dialogue failed, the government is having to deal with a longer list of demands, the latest from the clinical officers who also, starting midnight Wednesday, joined in the strike.
Without a CBA, there are what we call job groups that have been created by the Salaries and Remuneration Commission. They define, they describe the manner of pay. So if I'm in the same job group as you are, why should you earn 3 times as I?
The clinical officers accused the Salaries and Remuneration Commission of discriminating against them in their job evaluation and review of public workers' salaries. Sheila Sendeyo, NTV.